What does diabetic leg pain feel like? Hello. We are Diabetes Consciousness. We're here to help you find solutions towards your health. You may have heard about severe symptoms on the legs and feet when people have diabetes, and the importance of early detecting if any of these are a consequence of undiagnosed diabetes. That's why we want to explain what you must take into account so that you can clear your doubts. So today's main topic is, how does leg pain in a diabetic feel? We will talk to you about how this pain feels like, why it occurs, and the most important aspects related to this issue. Let's start. The painful symptoms in the legs caused by damages in the nerves tissues are medically known as diabetic neuropathy. Diabetic neuropathy is a common and serious complication for people who have type 2 and type 1 diabetes. This condition develops slowly, sometimes for several years. Yet, adequate control of the disease and a healthy lifestyle can help reduce the aggravation. All diabetic neuropathies develop gradually and progressively, making it difficult to notice any serious problems until considerable damage has been done. When these symptoms appear, it's important to bear in mind that the functioning of the digestive, urinary, circulatory system, and the body's natural healing systems may also start to get affected. The discomfort can affect your mood, sleep, and overall quality of life. Overall, nerve pain in diabetes can make simple activities very painful. Now, you might like to know, what does diabetic leg pain feel like? Symptoms. Symptoms related to legs and nearby areas don't have the same intensity for all people with diabetes. It manifests itself from mild symptoms to painful and disabling discomfort. As we discussed earlier, this condition directly affects the state of the nerves in both the legs, feet, thighs, hips, and buttocks. Sometimes, it even affects the abdominal area and chest. The symptoms are generally asymmetric, which means they appear on one of the two sides of the body. Sometimes it spreads to the other side, but it's not the most common. The symptoms, when there's damage to the nervous system in the legs, thighs, hips, and buttocks, can be like this. 1. Severe pain in the leg, towards the buttock and hip. 2. Intense muscle cramps and contractions in the buttocks, thighs, or calves. 3. Radiating pain that starts in the legs and hips and moves towards the abdomen and even part of the chest. 4. Numbness of the legs, prolonged tingling sensation. 5. Reduced ability to feel pain or perceive changes in temperature, easing the risk of damage and injury. 6. Burning sensation on the skin of the legs, buttocks, and hips. 7. Sharp, stabbing pain in legs and hips that tends to be worse at night. 8. Extreme sensitivity to the softest touch, even the rubbing of the sheets can be exasperating. 9. Muscle weakness, can be accompanied by the other sensations. 10. Loss of response to reflexes. The reactions get slow. 11. Pain in bones and joints. 12. Pain that increases when walking and decreases when sitting. 13. The difficulty of movement when changing positions, such as getting up from a chair. 14. Permanent feelings of heaviness or tiredness. 15. Joint deformities. 16. In the feet, serious problems such as ulcers and infections that are not perceived can occur. Before moving on to talk about how can diabetes cause leg pain, we invite you to subscribe to our channel and like the video. Our team is always carefully creating content that you may find valuable and make you feel safe as part of our community. We need to hear from you if you like our content, and we appreciate your response. Let's continue. How can diabetes cause leg pain? The progression and severity of leg pain depend on 1. Poor metabolic control of the disease. Presenting long periods of high blood sugar levels, over time uncontrolled high blood sugar damages nerves and impairs their ability to send signals. 2. Presenting high values in the HbA1c test. The glycosylated hemoglobin test indicates the average sugar levels in the last 3 months. 3. The age of the patient. Older people have a greater risk. 4. Time of evolution of diabetes. The longer the disease occurs, the greater the risk. 5. Having high cholesterol causes atherosclerosis, which decreases the blood vessel's capacity and restricts blood flow to the nerves, causing chronic and debilitating pain. 6. Have high blood pressure for a long time without stability. 7. Kidney disease. Kidney damage sends toxins into the blood, which can lead to nerve damage. 8. Obesity. Being overweight increases the risk of diabetic neuropathy. 9. Being a smoker narrows and hardens the arteries and reduces blood flow in nerves and tissues. 10. Vitamin D deficiency for a long time. The studies indicate that vitamin D deficiency may contribute to the development of painful diabetic neuropathy versus painless diabetic neuropathy. If you want to know more about this topic, we invite you to watch our video on home remedies to relieve diabetes leg pain, which will help you reduce discomfort until you can revisit your doctor. In our YouTube channel, you'll also find the video about types of medical treatments for diabetic neuropathy. We hope this information helps you find a solution path in your life. Please support us. Subscribe to our channel and activate the bell button to receive notifications whenever we upload new videos. If you want to know about a specific topic, leave us your comment below. Also, if this information is useful to you, share it and don't forget to give us our like it. You're the reason why we are here. Thank you.